morning, everybody. My name is Terry Mullins. I'm the section chief for the EMS and Trauma Systems section at the Department of Public Health and Human Services. It's my pleasure to welcome you here today for our annual EMS Service Award. It's a great honor and opportunity to honor the hard work and dedication of all the EMS providers out on the streets today, and of course to honor those of you who have been identified as awardees. This is your day, and we're very, very pleased to have you here with us. And with that, please welcome Deputy Director Laura Smith.
My name is Laura Smith. I'm the Deputy Director over at DPHHS, and part of my job is to oversee our Public Health and Safety Division as well as Child and Family Services. So today and this week combines two things that we feel really passionate about in the department. So in preparation for this morning, I was looking at some of our numbers related to EMS, and it was absolutely astounding to me the number of calls over the course of a year that we receive requesting EMS services. And you all know it because you do it every day, but the number from this past year, the number of total calls was over 130,000, and more than 7,000 related to children experiencing injury or illness. And so I think about behind every one of those calls is multiple stories about what's going on in a family's life. And I think about the expertise that it takes and experience and compassion to do the work that you do every day. And so I am very thankful to get to announce our keynote speaker today, who is someone who understands and supports the work of emergency service provider or EMS workers and teams. He also happens to be our governor. So please join me in welcoming Governor Gianforte.
Thank you, Lauren. It's a great space to be in. It's great to see you face to face. It's really an honor to be with you, given the life-saving work you do every day as emergency responders throughout the state. And for those of you from out of town, welcome to Helena, our capital. It's great to see faces with no masks on. So we have a lot of people here from Bridger, Conrad, Cooke City, Hardin, Thompson Falls, and Plentywood. You've all traveled a long way to be here, so thank you for making the effort. I appreciate you joining us today. You really are the best at what you do, and you've been doing this for decades. Like Ruth Walkerquist, who's here with us today. Where's Ruth? Hi, Ruth.
Big deal on the name that way.
I have it phonetically spelled.
Oh, good.
Ruth's been serving Shari County for over 30 years as a dispatcher, and I want to thank you for your years of service. We also have Dr. James Upchurch here today. Where's the doctor? In the back. Okay. We have seats up front. No, it's totally up to you. I was just who since 1986 has supported rural EMS when he became the medical director for Bighorn County Ambulance. Starting back in 1986, he became only the second person licensed as a paramedic in Montana when he got his certification. So thank you, Dr. Upchurch, for your leadership and service over all these years. Ruth and Dr. Upchurch and all of you as EMS providers across Montana offer critical life-saving services every single day. Laura mentioned that you took over 130,000 calls this past year alone. When people were in distress, they called out for help and you were there. 7,000 of those calls involved children, and while injury is the most common reason to dial 911, our EMS providers also responded to Montana's overcoming mental health episodes. So every hour of every day and every day of every year, you're dedicated and hard work are so important because you're there to answer the call 24/7. All 130,000 of these calls that you received last year. For our EMS providers in rural Montana, there are additional challenges. You often have to travel long distances to get to the people in need. We appreciate your hard work in working together to save lives. And together, we can all take steps as Montanans to support our EMS providers and save lives. One simple step is to learn CPR, so assistance can begin before EMS even arrives on the scene. The survival rate for cardiac arrest, for example, increases when CPR is given sooner. In instances where no one on the ground is trained in CPR, we appreciate the 911 dispatchers who actually coach people through it and help people give instructions on how to do CPR. And this saves lives as well. To promote CPR training, the state of Montana is offering CPR and first aid assistance training to state employees so they can help. Our Department of Health and Human Services partners with local volunteers to provide compression-only CPR training statewide. And since 2012, 60,000 Montanans have been trained in this life-saving technique. Montana also partnered with the Leona M. and Harry B. Helmsley Charitable Trust to fund many life-saving initiatives. In 2020, about 2,200 automatic external defibrillators were provided to law enforcement agencies across the state, and these save lives. In the hands of law enforcement, they're right there when we need them. Another critical endeavor is the Community Paramedicine Program. DPHHS is working with EMS providers across the state to implement community paramedicine. This program will better connect community members with healthcare and social service providers, and will also ease the workload for emergency care providers, cutting down on unnecessary EMS transport and emergency department visits. As Montana EMS services struggle with limited staff, time, and resources, this program really streamlines the process and gets more resources to the front line. It will save taxpayer money from going to waste and ensure Montanans receive better care when they need it. Of course, providing EMS in a state as large and as rugged as Montana is will always be a challenge, but I just so appreciate your dedicated and hard work. A recent report cited the need to greater broadband access for our rural and frontier communities to help overcome some of these challenges, and more reliable broadband will make learning opportunities more accessible and less costly for EMS providers. I'm pleased to report that we've made a historic investment to close the digital divide by investing in broadband. And we will be spending, I just signed this bill last week, because of the American Rescue Plan Act, we're allocating $275 million to expand broadband, particularly to bring it to areas of the state that are underserved. We're committed to getting more cable in the ground to improve how healthcare is delivered in Montana, also to help with educating our kids, and finally to help promote economic development in our rural communities so people can come home and bring their job with them. Once again, I just want to say thank you to all of your service. As I said at the beginning, you're there 24/7, and we depend on you, and your work is saving lives. You perform the work only a select few can do, and we know right now someone is calling 911, and emergency responders will answer that call, and will get there and will provide aid. It's a tremendous responsibility, but a critical one. To honor the life-saving work you do for our state, I was proud to proclaim this week to be Emergency Medical Services Week in the state of Montana, and today to be Emergency Medical Services for Children Day. So thank you again for your work, and I look forward to the award ceremony.
As I read your name, would you please come forward and be recognized, and also have a photo with the governor. The first award goes to the Voluntary EMS Provider of the Year, Steffen, from the Hardin Scholarship This award honors a volunteer EMS provider who is exemplary in his or her quality of patient care and dedication to the community. Roger has been an EMS provider since 1985, and in 1986, he expanded his expertise to include paramedic education. He volunteers for standby events such as local football games and most recently for COVID-19 vaccination clinics. Amy Goltz from Bridger states, "I have never seen someone who cares so much about their community as Roger. He puts his community above himself." Thank you, Roger. Our next awardee is Ruth Erickson from Pondera County Ambulance in Conrad. Excuse me, Conrad, pardon me. Pondera County Ambulance in Conrad, excuse me. Pardon me. This award is for a career EMS provider who exemplifies quality of care and dedication to the community. Ruth has been an emergency medical technician for Pondera County Ambulance for 28 years, primarily as a service manager. She was instrumental in kicking off Pondera County Ambulance's pediatric readiness program. Thank you for that. Rita French says, "I have never met nor worked with anyone who has dedicated and devoted as much time to helping her community, her team, and her patients." Thank you very much. This next award is for a great big group of people. It's for the EMS Service of the Year Award, the Cooke City Silvergate Emergency Medical Services in Cooke City. So come on up, please.
Cooke City, come on down.
An EMS Service of the Year exhibits dedication to improving patient care through education, injury prevention, community awareness, medical director involvement, and collaboration with surrounding EMS services. Cooke City's EMS service is a volunteer, non-transporting EMS agency in the remote community of Cooke City. While the community serves 70 winter residents and 200 summer residents, they have an influx of over 300,000 visitors per year that they have to care for as the entrance to the northeast corner of Yellowstone National Park. The nearest medical facility to this community is over 3 hours away by ground, and over the past year, this team has worked tirelessly with the Park County Public Health Department to provide COVID-19 information, testing, and vaccination in their community. It's not uncommon for a volunteer to spend 8 or 10 hours on a single EMS call, assisting folks in the backcountry and frequently enduring frigid temperatures and deep snow conditions. Your chief, Troy Wilson, states, "I am nominating the volunteer Cooke City Silvergate EMS team for their outstanding resilience during COVID-19 and their continuation and dedication to improving EMS services in our community. Not only were our volunteers on the front line of EMS calls during COVID-19, but they took it upon themselves to work with Park County Health Department to provide testing every week at the Cooke City Fire Hall, and then later offered rapid testing during the fall and winter seasons." Thank you guys very much. Our next award is for EMS Supporter of the Year, Dr. James Upchurch from Hardin. This award honors an individual who has demonstrated exceptional support for EMS, EMS agencies, and the broader EMS system. Dr. Upchurch is the medical director for Bighorn County Ambulance in Hardin and has been active in that role since 1986. He conducts monthly quality improvement with his crew to improve care for their next patient. Dr. Upchurch has been a constant supporter of rural EMS and has provided remote paramedic education to many emergency care providers in Montana. He is a fellow of the American College of Emergency Physicians and a fellow of the American Academy of Family Practice. He also holds, as we heard, Montana license number 2 for a paramedic. Lisa Fisher from Hardin says, "Dr. Upchurch is an excellent medical director. He will take time out of his schedule to attend and review run reports during the monthly quality improvement meeting to improve our care in our service. He is an excellent supporter of EMS and the community. The time and patience he provides each EMT and paramedic and his own patients is invaluable. Thank you, Dr. Upchurch. The 911 Dispatcher of the Year award goes to Ruth Lagerquist from Plentywood. This award recognizes a 911 dispatcher who has shown exemplary performance in their duties as the first responder in medical emergencies. Ruth has been a 911 dispatcher for Sheridan County for over 30 years. She answered the very first 911 dispatch in Sheridan County, and her co-workers joke that she will very likely answer the last one as well. Sheridan County's 911 Center adopted emergency medical dispatch approximately 6 years ago, which allows dispatchers to provide emergency care instructions until help arrives. In her nomination letter, Director Safira Olson from the Dispatch Center wrote, regarding a recent very difficult pediatric call, Ruth was calm and compassionate during what was a very challenging call. However, she was able to assist the caller with CPR instructions. I truly admire Ruth for being so calm and collected. Thank you very much, Ruth. Our EMS for Children award goes to Victoria Good of Thompson Falls Ambulance. This award recognizes an individual who has demonstrated excellence in providing pediatric EMS care and/or education. The awardee serves as an outstanding role model for her colleagues while consistently demonstrating commitment to high-quality professional EMS care to the pediatric patient. Victoria has been an EMT for 9 years. She started as an EMR in 2012 and then moved up to an EMT the following year. She currently works as Thompson Falls Ambulance Services Secretary in Sanders County. And she also works as the secretary and is working to become the Pediatric Emergency Care Coordinator. Thank you very much for that. Mark Broner of Thompson Falls states, I have observed many times during emergency calls your amazing ability to connect with children of all ages in a calming way. For any child to be involved in an emergency situation can be very stressful and emotional, but Victoria has a way of communicating to children and understanding their needs. Thank you very, very much. And that concludes our awards. Yes. Oh, okay. Gail, can we have all the awardees go over to the stairs and we'll do a photo with the governor? Is that right? Oh, when Shari's done. Okay.
Good morning. And I'm Shari Graham, and I have the privilege of working in the Department of Health in EMS and Trauma Systems as the EMS System Manager and working in support of all of you on a daily basis. I want to take this opportunity to give a special thank you to Deputy Director Smith and Governor Gianforte for your time and being here to congratulate the awardees, and truly want to congratulate all of you as the awardees for the work that you do and the honor that we're bestowing on you. Each year we take a few moments to remember some of the EMS providers we've lost in the past year. I'll read out their names and then we'll take a short moment of silence. So the names this year are Fred Cady, EMT with Fort Ellis Fire and Rescue, Loretta Higgins Park from Blaine County Ambulance, Lee Goldie, EMT with Park City Ambulance, Riley Hutchins, EMT with Laurel Volunteer Ambulance Service and Beartooth EMS, Ian Uhouse, EMT RN with Beaverhead County EMS, Bernard Taylor, EMT, Hobson Fire and EMS, Lorna Phil, EMT, Winifred EMS, sorry. Some of these are friends. Richard R.J. Johnson, EMT, Paradise Valley EMS. Pete Stock, EMT, Three Forks Area Ambulance and Willow Creek Fire Department. And Dan Maloney, EMT, Condon, Swan Valley, QRU. So let's take a moment of silence. All right, thank you all so much for being here today and for everything that you do for emergency medical service in the state of Montana. The 2021 theme is EMS Strong. This is EMS caring for our communities, and you all do that just beyond compare every day. Thank you so much. And that concludes our EMS Week celebration today. And we invite you to join us for some conversation, and we have cake in the back and water. And thank you again, everyone.